All right, if you are 65 or older, you may want to listen up. Medicare's annual enrollment period, it's coming.
Yes, you don't want to miss the deadline or delay your decision. Here with more insight from Carle is Kimberly Smith, Community Outreach Manager. Kimberly, we're glad to have you here today. Okay, let's just start with getting to know you a little bit. Tell us about yourself.
Hi, my focus is helping people learn about Medicare, helping them find a plan that fits their needs. I also focus on community outreach as far as connecting communities with resources and then helping people with their health and wellness benefits.
Okay, so now that we've set the stage here that you are the expert, let's kind of go over why this time of year is so important for people who are eligible for Medicare.
So the Medicare annual enrollment period is October 15th through December 7th. That is a very important time. That is a time for you to review your plan that you're currently on to see if there are changes that you want to make. That is the time for individuals between the age of 65 to pick a plan. That is a time for you to make sure that it's there for you and it offers the benefits that you need.
Okay, so let's break this out a little bit.
Sure.
What is Medicare?
Medicare is a federally funded insurance program that is comprised of 4 parts. You've got Part A, Part B, Part C, and Part D. It is eligible for people over the age of 65 or individuals under the age of 65 that have a select illness or disability. It is primarily focused for individuals who are going into retirement.
So I read here in these notes where it says most people must enroll in Medicare. Must? They have to have Medicare? Is it an option? Like you can have it if you or you don't want it if you don't need it? I don't know. Does that make sense?
When people retire, you have to pick a health insurance plan because you're normally not off. Yeah, okay. Your employer group plan. So it's best to look into our Medicare plans that we have to offer.
Okay, and like you mentioned, A, B, C, D, and so forth. So let's talk the original Medicare.
Okay.
What that one is.
So original Medicare is Part A and Part B combined. Part A is your hospital insurance. Part B is your medical insurance.
And you may not need both. You may choose to go one or the other.
No, you have to have both.
You have to get both.
Yes.
Okay.
Yes, that's original Medicare.
I know, there's a lot to this. Okay, and then there's also like Advantage plans.
Yes, and that's what they call Part C, and that's Medicare Advantage plans. That is a more benefit-focused, huge plan that brings in Part A, Part B, and Part D. Part D is the prescription drug coverage.
And that's just something separate?
Yes, yes.
Okay.
But Part C combines all of those together, which is what we call our Medicare Advantage plans, plans like our Simplete plan.
So how do you decide which one of those plans is best for your needs?
So that's where we come into play.
Okay.
We have people that are well educated that will sit down, look at your needs, look at what you're looking for, your have-to-haves, your want-to-haves, and we want to make sure that it covers your cost that you can afford a month. We have a lot of plans that are $0 a month that have a lot of benefits to them. We want to make sure that your health is covered. So, if you have a lot of doctor visits, let us sit down, let us discuss what can help you.
What would you say that people appreciate most about, let's say, doing the Advantage plan over just the traditional route?
Yeah, so like I said, we have a lot of plans that are $0, and then it combines all of the parts from Medicare into one. So you don't have to worry about having Part A and Part B. Yeah. You don't have to worry about having a separate prescription drug plan. The Medicare Advantage plan combines all of them together, so it's more convenient. It mimics their employer group plan. So, if they're comfortable.
Something they may be used to.
Exactly.
Okay.
So if they're comfortable with that, they get in a Medicare Advantage plan, it's all in one.
Okay, we're out of time, but there are changes coming for 2023, including virtual health coverage, over-the-counter drug discount program. Oh my gosh, so much stuff here. Dental, vision, hearing, all of that covered.
Our dental plan has increased to $2,000 per year.
Wow.
As well as a no network, so you can see whoever you would like.
Wow.
Oh my gosh. Okay, now if people have questions, they want to learn a little bit more, what's the best way for them to go about doing that?
Stop at Carle at the Fields, talk to one of our representatives there, visit Simplete.org, or they can work with their agent.
There you go. And if you're feeling overwhelmed, kind of like Grace and I here, and we aren't even close to 65, definitely get in touch with our friends there at Carle and Simplete, and we will have all of that information at CALiving.tv. We do appreciate Carle for sponsoring our segment this afternoon. All right, now's the time, though. Don't wait and miss out.